Hello everyone, I'm Dr. Soumya Chakraborty, consultant orthopedic surgeon in Fortis Hospital, Anandapur. So today I'm going to discuss that how osteoporosis affects the knee replacement surgery. So osteoporosis is one factor we must take into account. But as we use the cemented implant in our country, mostly uncemented implant is still not available. So generally the implant sits well within the osteoporotic bone. So there is no bigger concern. But if the bone is too osteoporotic, then it definitely raises an alarm. So we calculate it with a bone mineral densitometry or a DEXA scan. So we need to look at the T-score. If the T-score is more than minus 2.5, you don't need to worry. But if it's less than minus 3.5, definitely it's actually a concern because your implant can subside with a very soft bone. So generally, we measure the bone density before the surgery, and also these days there are very good drugs or medications available in the market which can actually, your bone mineral density gets improved with those kind of drugs. Also there are a few injections which lead to rapid improvement in the bone density. So we'll ask all our patients to get your bone mineral densitometry done, and if it's found to be too osteoporotic, then we can prescribe some injection for you so that your bone density gets much better and we can do our surgery well. Thank you.